Hi, my name is Alexis Kelly and I'm a nursing student here at FSCJ. I'm currently in the ADN program and I'm going to be demonstrating an IV insertion today. I've got my doctor's orders. I'm going to check them with the MAR. The doctor has ordered a 20 gauge IV insertion and all of that is correct. I'm going to take that into the room with me as well as my supplies. I have my extension set, my IV start kit, my IV needle, my tourniquet, and my 3 mils of normal saline already drawn up. I'm going to knock on the door. I'm going to introduce myself and identify the patient using 2 forms of identification, their name and birthday. I'm going to have them repeat it to me as well as check it on their armband and make sure that it's all correct. I'm going to go ahead and perform hand hygiene and put on gloves. I'm going to ask the patient if they have any allergies, if they've ever had a mastectomy, if they have a fistula in their arm for dialysis purposes. Because if they do, we're going to use the opposite arm and the non-dominant arm, if at all possible. I can go ahead and get everything set up. I'm going to open my extension set. I have my 3 mils of normal saline. I'm going to go ahead and hook it up. I'm going to prime the tubing. Once I've done that, I can clamp it off and set it back down until I need it. I'm going to open my IV start kit. I'm going to grab my tape, take a couple of pieces off that I'll need later on. Once I've done that, I can set that back down. I'm going to go to the patient, make sure they understand the procedure. I can go ahead and apply my tourniquet. And I'm going to look for a distal vein that's both bouncy and resilient. I'm going to check the radial pulse first. Okay, once I've done that, I can start looking for my vein. I'm going to find one that's distal. It needs to be bouncy and resilient. Okay, I found it. I'm going to stabilize the vein by holding the skin taut. I'm going to grab my ChloroPrep. I'm going to work in a circular motion, inwards, outwards, cleaning the site that I want to use. And then I can set that to the side. Once again, I'm going to stabilize my vein, grab my needle, let the patient know that they're just going to feel a really big stick for a second. I'm going to insert the needle at a 15-degree angle with the bevel up. Once I've done that, I can observe for flashback. Once I've seen flashback, I'm going to pop the tourniquet, and I'm going to advance the hub into the vein. I'm going to throw my needle in the sharps container, grab my tubing. I'm going to hook the tubing up to the hub while stabilizing the catheter an inch above the insertion site. Unclamp the tubing. I'm going to aspirate, look for flashback within the tubing. Once I've seen that, I can go ahead and flush my normal saline into the vein. Once I've done that, I can clamp the tubing back off and remove the syringe. I'm going to grab my tegaderm and place it over the hub, leaving the end of it exposed for use. Apply my tegaderm, take the border off, initial it, date it, and write the gauge, which is a 20 gauge. I can grab some tape this part of the tubing, and then coil the tubing to the upward part of the arm and tape it there as well. Okay. Once I've done that, I'm going to let the patient know to let me know if they have any signs of infection, any kind of swelling, heat, pain at the insertion site, anything like that. And then I'm going to go and document the time, the date, the type of IV, the gauge, which is 20 gauge, and the patient's response as well as how many times it took, which was only once. And at that point, I would be done.